Parkinson's disease is, fairly common and prevalent throughout the society, and, there is help for Parkinson's disease. It consists mainly of four things. It's basically tremor, stiffness or slowness, difficulty with balance, and stiffness. So when someone presents with all these cardinal features, it's pretty easy to make that diagnosis. However, there are various forms of Parkinson's disease, and those we call Parkinsonism. And so it's our job as the physician to tease out by asking directed and pointed questions and try to figure out exactly what they're suffering from. It affects about 1% of the population over 60. And many of these patients may develop memory difficulties. Some of them have difficulty eating, getting up, moving, balance. Mobility is a huge issue, but there are also many non-motorical symptoms that come along with Parkinson's disease. Some of these can occur in sleep, something called REM behavior disorder. Other things that can happen, depression, apathy, memory difficulties, hallucinations. I mean, this is a disease that involves many areas of the brain. It's just not one specific area. So depending on, clinical presentation, we may make a diagnosis of Parkinson's disease, or we may make a diagnosis of Parkinsonism. And that's a very important distinction. We always say movement, exercise, physical activity, that's number one. Medication, that's number two. So I always encourage my patients to remain physically active, exercise program. I think more than ever we have so many options as far as medication therapies that span oral medications, injectable medications. One of the other options that we have are deep brain stimulators these days, which are little battery packs. They're planted under the skin and two wires are sent up into the brain, so we can basically jumpstart the brain tissue, and this remains very effective treatment these days. So we have to assess their level of impairment, where they are at any particular time in their disease state, and then address with appropriate medications.